Hello everyone, my name is Maria Teresa Galindo. I'm one of the family counselors here at Origins HealthCare. Welcome to today's presentation. The topic we will be discussing today is the difference between supporting the disease of addiction versus supporting recovery. This is an interesting and complicated topic because in my experience working with families for about 20 years, I strongly believe and I have come to, understand that as family members, when we have a loved one in our family who is struggling, we do our very best to help them with the tools and the information that we have at that time. Therefore, in order to support a loved one in the recovery, it is very important that we are aware of those things that will be helpful and those things that may help them to continue in their disease and make decisions based on that. The Substance Abuse and Mental Health Association reports that often family and friends of addicts of alcoholics don't understand the disease of addiction, and with the best intentions they actually could help the addict or the alcoholic, to continue in that addiction by protecting them from the consequences that can actually potentially initiate change. So today, our goals, our objectives are to define recovery, to identify what enabling behaviors are, to recognize the consequences of enabling behaviors for both your loved ones and for yourself, and to identify how to support recovery. The definition of recovery from the Substance Abuse and Mental Health Association is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And I wanted to talk about this definition of recovery to emphasize the fact that it's a process of change. So it is important to identify how we got here and what are the things that need to be modified, or how the family system and the changes that we need to make not just the patient and the family member, in order to support recovery. Often the process of change starts with family members prior to come to the treatment, when they see that their loved one is struggling, and they realize the importance of making changes. Sometimes family members see how their loved ones is struggling with their health. Sometimes their loved ones may be having legal problems. They may be having problems with their job, but the problems are enough for family members to express that concern and to somehow begin to set boundaries with their loved one. And these boundaries sometimes include asking their loved ones to come to treatment. So initially, family members feel relieved when their loved ones come to treatment, and they feel that the problem maybe will be fixed and everything will go back to normal after that. And it couldn't be any more different than that, because actually this is the time where the second intervention needs to take place, and that intervention is with the family and everybody involved in the patient's lives. So family members look at how they have been impacted, and they begin to look at how they can support their loved ones, in a healthy way, and all the changes that they need to put in place for this. Many times family members ask the question, how did we get here? So in many cases, long before family members identify addiction as being the problem, what they see is that their loved one is struggling. They see that something is wrong with the person. It could be that maybe their temperament change, or maybe their loved one is isolating, maybe they're lacking with their responsibilities. If someone is in college, their grades may drop, They may see symptoms of depression, and they see that these behaviors are also associated with their loved ones drinking or using substances. So some of the problems that the family members see are, problems with, attention deficit, depression, trauma. Their loved ones may be experiencing chronic pain. They may be having issues at work. There may be problems, in the relationship. And often family members, when they see these problems, they will try to help their loved ones, and they will try to correct and offer, to do anything that they can for them to help them. The problem with this is that when someone is having these issues and they also have a substance abuse, those issues will get worse if the substance abuse is not being addressed. So family members are focusing on addressing sometimes the incorrect problem, sometimes could be that those two issues exist, and we call that co-occurring or comorbid disorders. But the important part is that we are only addressing one of the issues. We are not addressing also substance abuse, and therefore the symptoms of depression, the symptoms of anxiety, will get worse. So family members begin to feel the frustration, sometimes the anger about doing everything that they can to help their loved ones and not seeing that the behavior is changing. Why it's so difficult for family members to identify addiction? A few things. One of them is that in the beginning phases of addiction, an addict and an alcoholic, it's pretty good at hiding it. So family members sometimes don't know, that is a problem. And another issue is also the stigma, that comes with addiction and alcoholism, that sometimes prevents family members from having these conversations. So family members try to help with, taking over responsibilities. They may be helping their loved ones financially. They will be doing a lot of things that they believe are going to help their loved ones to get better. And when their loved one doesn't get better, but they get worse, that's when they begin to feel the frustration and the resentment at a point where they may continue to do the things that they initially did to help the person, because it's the easiest thing to deal with them. And that's what we're going to be talking about when we talk about enabling behaviors. So understanding our roles in enabling and how it can be reversed is critical for anyone who wants to permanently break the cycle of drug abuse, alcoholism, and addiction, so we don't support the disease. Enabling is used in both positive and negative sense. In positive psychology, enabling is the empowerment of others as well as the implementation of positive resources to address a problem. However, enabling is also used as a term to describe when individuals when they're trying to help, but in fact may perpetuate a problem. Enabling is actually a distorted attempt to solve problems. Anytime that people help or allow another person to continue their unproductive, unhealthy, addictive, behavior, they are enabling. In the field of addiction, enabling is a term that we use to describe family members who rescue an alcoholic or an addict from the consequences of their own behavior. Enabling behavior is also anything that somebody will do for somebody else when they're capable of doing it for themselves. Includes taking responsibility for a person, blaming somebody else, making accommodations for a person's harmful behavior. It is also reacting to a person in such a way that we are protecting them from the full impact of their consequences. These are, in general, the signs or symptoms of enabling behaviors: denial, avoiding problems, taking over responsibilities for somebody else, controlling behaviors, suppressing our own feelings, and allowing substance abuse. We are going to be looking at a specific, examples in how this looks like for family members. But I want to spend some time talking about denial, because denial, enabling is directly linked to denial. Denial is a defense mechanism that is used when people find the truth or situations too difficult to deal with it. They use excuses, or they rationalize the behavior. They may be blaming others for their loved ones' behaviors. Another form of denial is justifying, minimizing their behavior. Um, Family members or friends refuse to accept the reality that their loved one is having a substance abuse problem, and actually convince themselves that treatment is not necessary, and that the addict or the alcoholic will be able to control the drug or alcohol use. So that is one form of denial. Another form of denial is the inability to recognize how the behaviors affect work, school, or relationships or finances. And I often hear things such as, but they're doing really good at their job. We don't have any problems, in our relationship. And that is actually one of the most striking forms of denial for family members, and is refusal to acknowledge the deterioration of the relationship that they have with the substance abuser. So by ignoring the problem and not confronting the substance abuser, the substance abuse will continue to progress. So any behavior that supports the addict's delusion that the drug or its substance abuse problem, it's not the real problem, and helps them to avoid responsibility for their behavior, is enabling behavior. Anything that a person, a friend, a family member will say that will give the addict or the alcoholic the impression that the problem is something else. So this is a list of enabling behaviors, and what I would like to do as we go through this list is to see if you relate to any of these. And remember that the goal here is to be able to identify any behaviors that may have been helpful for the person with the substance abuse to continue in their disease, so we can make changes, so we don't continue to do that. So something else that I want you to keep in mind is that enabling behavior is a behavior that is present in relationships even when there is no substance abuse. So it's not exclusive of substance abuse enabling behavior. And as a matter of fact, in some of the work that I have done with families, I find out that those enabling behaviors were present way before the substance abuse. And this is particularly common with a relationship between parents and children. So even when the kids were little, way before the person came to treatment, the parents were doing these things for them. And what addiction does is exacerbates these behaviors. So this could be present even also in relationship with the spouses. So really in any relationship. So our goal is to create awareness about these behaviors so we can begin to implement changes that support recovery. So some of the behaviors are protecting a person from the natural consequences of their behavior. That include paying for bills, paying for lawyers, providing a person with a job if they lost their job, paying for the tickets, paying for their bills. And these will actually won't prevent the consequences. What will happen is will delay the consequences, and sometimes the consequences could be even greater later on. Taking on the person's responsibilities for them, so any overdue bills, taking responsibilities for what they're responsible at home, which could be taking care of the children. It could be the financial responsibilities that a person has at home. Um, it could be taking the kids to the school, taking them to soccer games, anything that there was an agreement before that the person was going to do and the person is no longer doing and somebody else is doing for them. And it could be something very small. It could be something as small as taking the trash. But what is the reason I'm taking the trash? If someone is not capable of doing it, remember that that is okay. But if the person is no longer doing it because they are using substances and therefore they're not participating anymore in the family, that's different. Making excuses for the person's behavior with friends, with family members, with employers, could be making excuses if somebody is at a family gathering and they behave inappropriately. Maybe they're making inappropriate comments to somebody else. Maybe they use language that they normally wouldn't use if they weren't under the influence, and the family member feels embarrassed and they feel the need to excuse the person's behavior. Sometimes family members will take responsibility for this behavior, so to avoid, their loved one embarrassment. Keeping secrets about the person's behaviors. This is the most damaging in families when family members keep secrets from each other. So not only keeping secrets will support the disease when it comes to allowing the person to continue to use, but also it's creating a lot of conflict among other family members, and therefore the trust is broken with the person with the substance abuse. But it could be the trust among siblings, the trust among couples. So in general, this is very damaging because trust is broken. Giving money that is undeserved or unearned, that more likely the person with the substance abuse will use to buy alcohol or buy substances. Attempting to control situations, and this could be searching the house for bottles or for the stash and emptying the bottles. It could be choosing what the person's friends are, or what are the activities that they're going to be doing, or the activities that they are not going to be doing, who they go out with, or who they are not allowed to go out with anymore. It could be even attempting to control by changing what normally we'll do as a family. So if we are going to go to a restaurant, to be sure that we are picking a restaurant where they don't serve alcohol. So really trying to control every scenario and every situation to be sure that the person is not going to be using substances. Threatening to leave or kick the person out of your home and not following through with those threats, which will only reinforce the behavior and will give the person the message that you don't really mean what you say. drinking or using drugs with the addict in an attempt to strengthen the relationship. I hear this a lot. In some of the reasons, I hear people drinking with their loved ones. So I have worked with couples, just to give an example, who maybe their loved one has been in treatment a few times, and they feel that the only way that they can connect with their loved ones is by also drinking with them. I have heard things such as, that's the only thing that we have in common. However, I have also heard from patients, when we talk about this exact situation, that when their loved ones is drinking with them, it's confusing. So of course, in the midst of their addiction, it is convenient, but it is also very confusing in why sometimes this behavior is okay and when sometimes it isn't. As I mentioned before, seeing the problem as a result of something else. So justifying that the substance abuse is caused by the person's experiencing depression or anxiety, or the person is shy and they need alcohol to be more social, or maybe there is trauma and that is the reason for what the person needs to use substances so they can cope with experiences that they had in the past. So enabling behavior has consequences for both, for the person who is being enabled and for the enabler. For the person who is being enabled, it really prevents their psychological growth. And for the person who is the enabler, they experience negative symptoms. So the enabled person will come to expect that someone will always be there to fix their problems, and their consequences will go away. They will expect that there will not be negative outcomes for their behavior, because they really haven't experienced having to take responsibility or make any changes. They will be actually prevented from building the skills that they need and the motivation to do things differently, to take responsibility, and to actually reach their full potential. The enabled person will not learn how to solve problems. So when we are fixing things for other people, when we are problem solving for them, we are not giving them the opportunity to learn these skills. They will also be stuck in these roles, and they, when they're not able to take responsibility or solve their problems, they begin to feel incompetent, and they actually believe that they're not capable, and they're very disempowered. On the other hand, family members or the enabler become emotionally hostage because their loved ones learn how to manipulate them and to get out of them what they want in their active addiction. And with that, the enabler is in a constant state of stress, and it's frequently walking on eggshells, avoiding conflict. And the reality is that we will end up at the place that we are trying to avoid when we are not addressing the substance abuse, because as the substance abuse progresses, the crisis and the problems become greater and greater. Putting an end to enabling behavior can be scary for those who have been caught up in the negative cycle of enabling and codependency. And when you enable an addict or an alcoholic, you actually think that you are preventing things from getting worse, so you continue to participate in unhealthy enabling behaviors. When you stop enabling, this does not mean that you stop loving the person. It does not even mean that you cannot help them anymore. but it means that we have to find healthy ways to support them in their recovery. So, and what do we mean by acceptance is accepting that addiction is a chronic disease and not a choice. Um, if you learn about addiction and any co-occurring issues that your loved one is having, the more that you know about how addiction develops and how drugs affect the brain, you will be in a better position to empathize and understand what your loved one is going through. You will be able to separate yourself from the problem and gain perspective so you can respond with objectivity. Accept that you have absolutely no control over someone else's substance abuse problem, that the only thing that you have control of is how you respond to it. It's you have control over what you will accept or you will not accept, and how you will respond when these things happen. It is also important to accept that change is a process that takes time for your loved one, for yourself, and more likely this process will be somehow uncomfortable. So to live through the discomfort and be able to overcome any barriers that you come along with that. So one of the skills, that are very important to build in the process of change is high frustrations tolerance, meaning that the more that you practice this skill, the stronger that you will get at it. It's kind of like a muscle. To practice high frustration tolerance, you put reason between an impulse to escape discomfort and discomfort actions, dodging actions. So once you delay reacting, you are actually in a position to start choosing. By working at building high frustration tolerance, um, you will be more likely to deal with the discomfort, and you will not go back to old patterns of behavior. The three C's of Al Anon, and they are that you didn't cause this disease, you don't cause your loved one to drink, it's not your fault. Um, it is their private battle. You cannot control it. You have no power over the other person desires to drink. You can only control how you respond to it, and how the things that you're going to do to take care of yourself, and you cannot cure it. So if you really understand that this is a disease, then you understand these three C's, that you can cause it, you can control it, and you can cure it. The most important thing that you can do as a family member is to take care of yourself. In a study that was done with 100 families, actually researchers found that those family members who cope with their loved one addiction by quietly tolerating their behavior had the lowest scores of psychological well-being. And if you really think about it, if you are completely depleted of all your resources, your ability to support your loved one in a healthy way is very diminished. So it is critical that while you support your loved one, that you also take care of yourself. Be careful of falling into a pattern of putting the needs of your loved one above yours. You can start working to letting go of responsibility of your loved one's addiction. That would be the first step. There are ways also that you can help to improve your emotional well-being while living with the high levels of stress that are common, for someone who is suffering from a chronic disease. And some of these things are the same things that we, encourage your loved ones to do while they are in treatment. So practicing meditation, exercising, practicing self-compassion, and letting go of the past. So you ask yourself, at some point how you've been affected by the disease of addiction, you were able to identify. If you haven't done that, this is the wellness wheel, and it's a good tool to look at, you know, with your loved one's addiction, were you affected emotionally? And if the answer is yes, how? Were you affected spiritually, socially, physically? Were you affected in your job? And really write down all these impacts of addiction in your life. And then after that, use the same wellness wheel to write down the changes that you will begin to put in place in your recovery. And these changes will help you to work your own recovery process. Remember, it's a process of change in which people improve their health and wellness, and they live, you know, self-directed lives, and they can reach their full potential. So you can work on recovery for yourself when you work on your wellness wheel. Open, honest, and direct communication is definitely a very important element for family systems. And families who are in crisis become very close and isolated, and they stop communicating with each other. So to open up the family system by being very honest with each other, it's an important step in recovery. Now, before you can be honest with other people, you got to be honest with yourself. You got to be honest about how you feel and how you've been impacted by your loved one addiction. If we don't recognize that before we communicate to our loved ones, you will be communicating maybe, blame. Maybe you will be communicating that it is your fault. Maybe you will communicating that you are fearful about protecting yourself, and you will be fearful to communicate what your needs are. So be honest with yourself first in how you feel and how you've been impacted, and then you can move to the next step, which is to communicate to your loved one. And a very powerful tool in recovery is I statements. If you have never heard of I statements means that you only speak about you, how you feel and what you need, and the steps that you are going to take for yourself to take care of your needs. So with that, you can also communicate to your loved one that you are aware of their problem and, and how has affected them and how is affecting your relationship with them. um, you will, you can communicate to them that you will not tolerate unacceptable behavior anymore, that you are going to be taking care of yourself. That also means that you will support them in their recovery. So sometimes we are under the impression that when we are communicating to other people, how we're going to take care of ourselves and the things that we will not accept any longer in the relationship, that maybe we are not being supportive. So there's doesn't have to be one way or the other one. It's actually a combination of both. And when you communicate what you will accept and you will not accept anymore, you can also communicate that you are there for them and that you will support all their recovery efforts. Communicate to your loved one that you are no longer willing to participate in their addiction, whatever that means for you. Participating could be using substances with them. Participating could mean that you are doing any of the enabling behaviors that we talked about before, and that you will no longer be doing these things. Doing those things ahead of time, helps other what to expect from you. So find, first, identify what are those behaviors that you are no longer willing to do or get involved, and then communicate to your loved one where you stand. Also encourage your loved one to get professional help when they are struggling, and to follow recommendations from the professionals. Don't put yourself in a position to solve all their problems. There are other people that they can reach out to that have the objectivity that you don't have. So communicate to your loved one that it is important for them to reach out. And with that, sometimes we have to practice saying no. And what do I mean by that? The things that you will do, the things that you will not do anymore. And sometimes this is a difficult skill for some people. I can personally tell you that for some time I struggle saying no to family members, people that I love. So the way I cope with it and the way I encourage people to do it is to find some mid ground. Saying no to someone that you love when you've been doing things for them could actually trigger a lot of fear in you. And an alternative to that is to say to your loved one, I don't know, or let me think about it, or have you check with somebody else. And when you do that, you're actually giving yourself the space and the time to evaluate what you want to do in this situation, and to actually also assess that your response will be on alignment with who you are as a person and what your values are. And the last one, it's no keeping secrets, which is just being completely open and transparent with each other, not just with your loved one who is in treatment or who has the substance abuse, but also opening up the whole system, the whole family, that you will make an agreement with other family members that you will be honest with each other. Boundaries are, sometimes a very touchy subject or topic, because sometimes boundaries are misunderstood as ultimatums. Boundaries are understood as punishment. There is a belief that boundaries are telling somebody else what to do, and boundaries sometimes could be rigid or could be harsh. There's also a misunderstanding that when you are setting boundaries, this is a form of control. But when you are setting boundaries, you are actually making a request. You are not telling someone what to do. You are making a request, and you are giving the option to say yes or to say no, or maybe to negotiate if that is something that you are willing to do. It's never a form of control. So let's look at what boundaries really are and what boundaries are not, and what is the process of setting boundaries. A working definition of boundaries are that personal boundaries are guidelines or limits that we create to identify what are reasonable and safe and permissive ways for others to behave around us, and also how we will respond to those limits. Boundaries help us to honor, who we are, and to love and work with people without experiencing resentment, and by being truthful to ourselves, by protecting our integrity. Boundaries, there are basically two kind of boundaries. There are external boundaries and internal boundaries. And external boundaries allow you to determine what's okay and what is not okay in your relationships, while internal boundaries are between you and you. Having healthy boundaries with yourself is critical to the recovery process, and not just for your loved one, but for yourself. In their attempts to help their loved ones, family members have severely damaged the relationship they have with themselves. And rebuilding self-confidence and experiencing self-love is an ongoing process that takes time and dedication for family members. So when we talk about internal boundaries, is an examples of that is the way that we speak to ourselves. It's important, sometimes to ask yourself this question: do I speak to myself in a way that I will never speak to a person that I love? Do I tell myself things that I will never tell somebody else? Do I treat my body, or do I treat my time in a way that I will never recommend anybody else to do it? So if we don't have healthy internal boundaries, this is a way to communicate to others lack of self-respect. And therefore, if we communicate to others that we don't respect ourselves, the likelihood of others crossing our limits is really high. Why do we need boundaries? So setting boundaries help people to know what to expect. One of the things that happens in the crisis of addiction is that there's a lot of unpredictability in the relationships. And when we don't know what to expect from others, that creates a lot of anxiety in our relationships. So when we are able to tell others what's acceptable and what is not acceptable for us, we are actually teaching people how to treat it. So when we do that, people's levels of anxiety decrease, right? Your own level of anxiety decrease, and therefore we can have relationships that are more healthy. So remember that boundaries are the mechanisms that bring safety into your life, and it's a healthy control. So when you practice internal boundaries and you work on your own anxiety and your own fears before you do something that will go against who you are, what your values are, that is actually practicing healthy control. When we try to control somebody else's behavior, and when we tell other people what they need to do or what they should do, that is unhealthy control, because we can actually not control the outcomes of what people will decide to do. So look at healthy boundaries as a way of keeping, toxic elements and toxic people out of your life and out of your relationships. When we do that, people actually work better together, and they are less likely to leave a relationship. When you know what to expect from others, you are more likely to also feel respected, and you are more likely to want to be in a relationship with this person because you feel safe around them. Also, creating boundaries is a way of breaking the pattern of enabling, right? Because when you are setting boundaries, you are actually asking yourself the question, whose responsibility is this? And if the answer is this is your loved one responsibility, you let them take care of that. And if the answer is this is your responsibility, that is your opportunity to communicate the steps that you're going to take care of yourself. So setting boundaries between yourself and your loved one, it's a way of breaking that old pattern of behavior of taking responsibility for what is not your responsibility. And in your side, setting those internal boundaries means that you are going to work on what we spoke about before, which is working on your high tolerance and, for frustration. Because I wish that when we start setting boundaries, and again, in my work with families, this is something that I really haven't experienced, is that when others begin to set boundaries, people begin to set boundaries, whether it is the patient or the family member, I really haven't heard like, oh my gosh, thank you, I've been waiting for this for such a long time. Usually what we face is some sort of resistance. If my family member is used to me, if your family member is used to you saying yes to everything, taking responsibility, that initial step where you begin to take care of you and you begin to say no, it's something that more likely and will be absolutely normal your loved one will resist, right? So to know that and to understand that this is a normal part of the process, is part of setting boundaries, and to work on your internal boundaries and how you're going to manage your anxiety when these situations take place. When family members set boundaries, right, this speeds up the recovery process for the person with substance abuse, because when you are no longer doing things that are their responsibility, then they have motivation to change. They begin to experience the consequences of their own choices, which could really motivate them to make different choices and reach out for help. So what are the steps for setting boundaries? To identify when your boundaries are being crossed, you gotta stay tuned into your feelings. Some red flags that your boundaries are being crossed are when you experience discomfort, when you are experiencing resentments, when you are feeling stress, you are feeling anxiety, maybe you are feeling angry, you are feeling fear. So your body tells you, your body is actually giving you signs that something is wrong and that you need to take action to protect yourself. So do not ignore your feelings. When you acknowledge your feelings, you are working on your internal boundaries. So your internal boundaries and setting limits for yourself comes before you can tell someone what's acceptable and not acceptable for you. So if you are angry, that is okay. And sometimes I tell family members, if you will tell me that you are not angry, I'll probably be very concerned for you, because that probably is a form of denial. And remember, we talk about a form of denial for family members is when they believe that everything is great in their relationship. So if you have been in crisis in a while and you are angry and your needs haven't been met, that is a good place to be. So acknowledge that, right? Do what you need to do to take care of yourself. Ask yourself the question, what boundary is being violated right now that I'm experiencing these very uncomfortable feelings? Is the boundary maybe a physical boundary? Is an emotional boundary? Is that an intellectual boundary? What kind of boundary is being crossed? And who do I feel this way when I'm around them? Right? So identify your feelings, identify why are you experiencing this feeling, and who are the people that you experience these feelings when you are around them. The next step is to identify your values. So knowing your values is an important step for setting boundaries because they help to determine what your needs are. Your needs for safety, your needs for connection, your needs for honesty. And our boundaries are like the compass that help us to decide if we are going to say yes or we are going to say no, or we are going to say, I really don't know, I need to think about it. So when we live according to our values consistently and repeatedly over time, we experience a sense of satisfaction. I would like you to think about maybe somebody in your life where you experience, happiness when you are around them, that you feel safe when you are around them, that you actually look forward to be around them. If you really take some time to think about this, more likely you are feeling this way because you are living by your values and this person is respecting those values. So our values help us to prioritize what's important in our lives, right? Values are the most important things in our lives, and they act like guidelines that help us to make decisions. So if we don't know what our values are, then we are gonna struggle in making decisions in what we do and what we don't do. So I highly encourage you all to look at what your values are. This is an important part in your lives. We call this a significant event when someone comes to treatment, and we have to reevaluate the things that are important for us. I included on this slide a website that you can go to look at a list of core values and determine what are the most important values right now for you. And once you have identified, and sometimes it helps, to prioritize. So the list is about maybe 200 values, and you go from 200 to 25, and then you continue to narrow the list to 10 values, and then you narrow that list again to 5 or 3 values. And those 3 or 5 values that you end up with are the most important things for you. And living by those will be the way that you set boundaries, and that will help you to decide what you do and what you will not do. So for each core value that you identify, you can ask, what will you allow in your space given this value? And what won't you allow in your space given this value? And when I mean your space, I mean your wellness will. You know, is this safe for me to do or to allow in my spiritual space, in my intellectual space, in my emotional space, in my physical space? And if the answer is yes, then you do it. And if the answer is no, then you don't do it. And if you are not sure, you evaluate again. So how you communicate your boundaries to others? Once you have a list of your core values, once you know the things that you are going to be protecting and what your priorities are, then you can make a request that the other person, respect these, because you are expressing and you're telling me what your needs are in this relationship. So there is a big difference between making a request and making a demand. So when you're making a request, you are asking the person very clearly and very specific, what are the behaviors that you cannot accept because they actually you don't feel safe around these behaviors. So um, don't don't assume that people know what your boundaries are. Even if you have living with them for 30 years, even if they're your child, if they are your spouse, if they are your parents, and you think that they should know better, um, assumptions are one of the greatest barriers on setting boundaries. So be very clear and very direct and assertive about what they are, and communicate those to them without making assumptions, because sometimes people don't intentionally violate boundaries. They just really don't know where the line is. So believing that the other person should know what to do, it's actually going to prevent you from being successful when you're setting boundaries. And in reality, if you don't ask for what you need, you don't really have a right to get upset because you are not sure. At least you check with the person that the person really knows this is what you need in the relationship. Communicate to the other person the steps that you will take if they choose not to honor and respect your boundary. So once you have communicated to your loved one what you need in the relationship, you can also communicate to them the steps that you will gonna take if your needs are not being met. Start small. That I think is one of the best ways to set boundaries, is to start doing things that you feel that you will be able to be successful when you set these boundaries with your loved one. So because setting boundaries, as I mentioned before, could bring a lot of fear in for us, and in our relationships, and in the beginning could bring some tension. And again, this is all healthy and this is all part of the recovery process, but we have to acknowledge that we more likely will be uncomfortable through this process, and the other person will too. So you may want to start small. And an example of that could be you telling your loved one something like this: I feel overwhelmed when you raise your voice, and I would like to ask you to lower your voice so we can finish this conversation. And then you can move on to other boundaries that may be more difficult, but when you start small, you also giving your loved one an opportunity to understand in small steps that you are no longer on agreement to some of the behaviors that they are presenting when they're around you. Honoring your values is where many people struggle as they find it challenging. So, a good way to look at how to honor your values is to identify your power center. What are the things that you have power of, and what are the things that you don't? What are the things that you are responsible? If you don't think that you have power around something that you do, that's a huge problem, and vice versa. So first identify where the power is, and then communicate to the other people in advance the steps that you will take if your boundaries are crossed. And one important part of setting your boundaries is that when you are communicating what are the steps that you will take, you don't need to apologize. Do not apologize for taking care of yourself, for protecting your safety, for asking for what you need in the relationship. Also, figure it out where you will compromise and where you will not compromise. And the way to do this is looking at your core values. If you do the exercise of the core values, your core value number 1, 2, and 3, maybe even 1 to 5, are things that are important in your life to feel safe, that you are not willing to compromise despite the person or despite the circumstances that you are in. So those are the things that you don't negotiate. And then if you go down the list, there may be other things that are important for you in your life and in your relationships, that in order to collaborate with other people, you may need to negotiate. So important to know where the line is. These are the things that I need and I will protect and I will not negotiate. And these are other things that, could be more flexible. Also, determine how you will respond if your boundaries or when your boundaries are being challenged. So remember, the internal boundaries are your relationship with yourself and the decisions that you make, and how you're going to respond during challenging times, and how you're going to respond to, so you are okay with your responses, that you are not going to feel guilt, or you are not going to feel remorse about the way you respond when somebody is presenting with a behavior that is unacceptable for you. Immediately stop anything that doesn't honor and respect who you are before it becomes a problem. So there are some behaviors that you may need to address with your loved one, that you already know that they are a problem, and it is important to be very honest and open about this, mostly if those behaviors are violating any of those important values in your life. But sometimes things start happening, and we don't want to make a big deal out of it, and we don't address them, and then they become a big issue later on. So anything that you feel, those emotions that we talked about before that are your red flags, address them right away before they become a big problem. Because if you have this red flag and maybe it's something that is small, your feelings, your anxiety won't be that great to address that problem, and more likely you are preventing this problem to get bigger, which in return, if the problem gets bigger, you probably will be more hesitant to honor your values, because maybe you will experience greater consequences emotionally when you do that. So do it as soon as you can, and decide what the consequences will be ahead of time if any of these are violated, so you will be prepared. It's always good to have a list of responses that you can have, like a backup plan. If this happens, this is how I will respond. So you are prepared when those situations take place. And of course, if you are gonna establish a consequence, if you communicate a consequence, it's very important that you follow through. You don't want your boundary to become a threat, and your loved one to believe that they can continue with the behavior because you will not follow through. The way sometimes that I look at boundaries is like antibiotics. So if I have an infection and I'm prescribed an antibiotic that will fight these virus or bacteria, what are the recommendations? The recommendations are that I take it every day. Usually the first dosage, it's like bigger, and stronger than the following ones. And then I have to continue to take it every day consistently at the same time. Because if I don't, then the virus or the bacteria will create resistance. And then that boundary, that antibiotic, is no longer going to work, and you're going to have to think about other ways to deal with it. So I like to use that analogy when I think about boundaries, and when I think about what happens when we don't honor them, when we are not consistent, and when we don't mean really what we say to our loved ones. So say what you mean when you say it, and don't be mean when you say it. So as we mentioned before, part of the recovery process means accepting that this is a process that could be uncomfortable if we are making changes, and therefore it is important that we reach out for support. Family members find themselves isolated many times when their loved ones have been dealing with the disease of addiction for a while. So it is important that you reach out. And a few things why it is important to reach out. And one of them is because when you reach out to other people, you can do a reality test about how you're feeling, what your thoughts are. Is the situation valid? Are you overreacting to the situation? Maybe you are underreacting to the situation. Maybe you are setting boundaries that are unrealistic. But also to receive validation, because family members find themselves questioning themselves a lot. So what are places where you can get this support? And it is important that when you reach out for support, you reach out for support that is objective and knowledgeable. So 12-step meetings are a great place to get support from others who are experiencing similar situations, and regular attendance will help you to get this support in an ongoing basis. So Al-Anon meetings, Codependence Anonymous, Adult Children's of Alcoholics meetings, and also participating in therapy could be of great, help for family members. So on one hand, individual therapy. If I need to work on my internal boundaries, if you have identified that you need to work on your internal boundaries and how you cope with situations, having your own work done will help you to then transfer that to your relationships. And also family therapy. So with family therapy, it's doing this work together. So we work on opening up the family system. You work on keeping each other accountable to work a recovery journey. Also, you can all support each other in a healthy way. And lastly, empowering. And when you empower someone, you are giving that person back the control of their lives. You give them a message that they are responsible for themselves. You give them a message that they are actually capable, and that you do have faith in them. It's very disempowering when we are around people who we perceive they see us as someone who is incapable of doing things. So doing the opposite, really, showing faith, listening without fixing, discounting, or judging, communicating respectfully, and assertively about how you feel, and describing behaviors that may not be acceptable, and letting them know what the boundaries are that you will put in place. You can also empower someone when you give them information, and you can provide support that way. And there is a difference between giving your loved one information than giving them orders of what they need to do. And encourage them to make their own decisions. And of course, with their own decisions, they also will take responsibility for the consequences of their decisions. And it is important for family members that we encourage our loved ones to learn from their mistakes, because we probably are going to mistakes both, your loved one, yourself, will make mistakes through this process, and that is okay, and that we can accept that that is part of the learning process. So I want to end with this quote: success is the sum of small efforts repeated day in and day out. And that really describes what recovery looks like for your loved ones and for yourself. When a person is struggling with addiction, the disease of addiction can affect everyone surrounding that person. Family and friends, often in an attempt to help, they change their behaviors and they become enablers. So family is greatly affected by their loved one addiction, which means it is very important for them to become involved in their recovery and to work their own recovery process, which includes accepting addiction as a disease, learning about the recovery process, and finding support for yourself. So take the necessary steps that you need to do to take care of yourself and reach out for support. I'm glad that we have this opportunity to share this information with you, and I'm looking forward to continue to work with you the rest of this week. Have a great day.